In last video I have discussed about the anatomical positions, border surfaces of the ilium, ischium and pubis. Now in this video I will discuss the attachments. So let's start with the ilium. I have discussed this is anterior superior iliac spine, this is anterior inferior iliac spine which forms the anterior border, right? So attachment on anterior superior iliac spine is it's easy, inguinal ligament and sartorius, right? Two attachments, one ligament, one muscle. Anterior superior iliac spine. Similarly, anterior inferior iliac spine we have attachment of straight head of rectus femoris and iliofemoral ligament. So one muscle, one ligament attached here, one muscle, one ligament attached here. Anterior superior iliac spine, inguinal ligament and sartorius. Anterior inferior iliac spine, anterior inferior iliac spine. We have attachment of iliofemoral ligament and straight head of rectus femoris, right? Now, crest. So attachments on the crest are very important. So we have outer lip, inner lip and intermediate area, right? So let's start with the outer lip. Outer lip we divide it into anterior 2/3 segment, anterior segment and ventral and dorsal. So we have anterior 2/3 and ventral or anterior 2/3, dorsal 1/3. So anterior 2/3 we have attachment of fascia lata in its whole extent and tensor fascia lata muscle also, right? Including the muscle external oblique is attached or onto the anterior 2/3 of this segment on the outer lip. So external oblique is attached onto the outer lip, right? Ventral segment, ventral 2/3. Then we have internal oblique which is attached onto the intermediate area, right? Then we have transverse abdominis which is attached onto the ventral 2/3 of the inner lip of the crest of spine. So outer lip has external oblique, inner lip has transverse abdominis, intermediate area has internal oblique, right? So along in its anterior 2/3, remaining 1/3 dorsal surface, remaining posterior segment. In the outer lip we have, in front we have external oblique and latissimus dorsi in the posterior segment, right? Similarly, internal oblique in the ventral segment and we have quadratus lumborum in the dorsal segment, right? Here we have latissimus dorsi, here we have quadratus lumborum. Then on the inner lip we have only transverse abdominis muscle, right? Now this is spine is crest of the spine is finished. This is iliac fossa. So iliac fossa we have attachment on the medial 1/3 we have iliacus muscle attached here, right? Originates from here, iliacus muscle. Now let's discuss the gluteal surface first because it's easy and important. So in between the anterior gluteal line, inferior gluteal line and anterior gluteal line lies the gluteus maximus. In between the anterior gluteal line and posterior gluteal line lies the gluteus medius. In between behind the posterior gluteal line we have gluteus minimus, maximus, medius, minimus, right? Now these are easy. Now we have a remaining surface that is called the sacropelvic surface, right? Auricular surface articulates with the auricular surface of the hip bone, right? As I have shown in this bone, right? So on the dorsal segment we have this area, sacropelvic area lies towards the dorsal segment, right? So erector spinae muscle will attached on its medial slope and on the lateral slope lies the gluteus minimus, right? And towards the medial side we have gluteus maximus, and towards the lateral slope, medial slope we have the erector spinae muscle, right? Here lies the interosseous ligament, right? Here lies the interosseous ligament, here lies dorsal sacroiliac ligament, right? Dorsal sacroiliac, here is the interosseous sacroiliac, and on the margin of this auricular area near the preauricular sulcus, here is a sulcus present adjoining the auricular area, that is called preauricular sulcus. So here lies the ventral sacroiliac ligament, right? So three ligaments are attached here: interosseous sacroiliac ligament, here in between the dorsal and the auricular area. Dorsal sacroiliac ligament behind the insertion of the erector spinae. Here lies the iliolumbar ligament, attachment of iliolumbar ligament. So ligaments of this are complete, right? We have seen that straight head of rectus femoris arises from the this anterior inferior iliac spine. Similarly, the reflected head arises from the area behind the gluteus maximus, behind this acetabular, right here, reflected head of rectus femoris, right, and adjoining area. So ilium part is finished. Now come to the ischium part. So this is the pelvic surface, this is the dorsal surface, this is femoral surface, right? So from the femoral surface we have quadriceps femoris muscle arises from here, right? So we have ischial tuberosities. A lot many attachment are from the ischial tuberosity itself. We divided the ischial tuberosity into two parts by horizontal line, upper and lower, right? And then by oblique into superolateral and inferolateral. So this is superolateral, this is inferolateral, and lower area into by a vertical ridge into outer and inner parts, right? So we have discussed hamstring muscles. They originate from here. Semitendinosus, ischial part of adductor magnus, right? And long head of biceps femoris. They arise from the ischial tuberosity, right? So spirolateral area gives region to the ischial head of long head of biceps femoris and semimembranosus. Inferior one semitendinosus, and lower one towards outer one gives attachment to the ischial head of adductor magnus, right? So all the hamstring muscles, they rise from the ischial tuberosity. So we have finished the ischial tuberosity. Now we will discuss the pubic part. Now, so pubic tubercle obviously anterior superior iliac spine and pubic tubercle inguinal ligament. So medial end of inguinal ligament arises from the pubic tubercle and laterally it extends up to the anterior superior iliac spine, right? So pubic tubercle gives attachment to the inguinal ligament, right? So this is the pectinate line. So this is pectineal surface. Pectineus muscle arises from here, right? So anterior surface of the body of the pubis, we have a lot many muscles arising from there. So adductor magnus arises from the angle between the pubic crest and medial surface. Here adductor magnus, below the whole of the pubic rami and a small part of the ischial rami, gracilis arises, right? Immediately near to the gracilis, adductor brevis, right? To the margin of obturator muscle, obturator foramen, here lies the obturator externus, right? So internus arises from the inner surface, pelvic surface of the pubic symphysis, right? So outer surface we have finished. Now come to the inner surface. It is related to round ligament of uterus in females and testis and prostate in case of males, right? Now, so obturator internus is related to its pelvic surface, right? So this is all about the attachments of the bone. Thank you very much, students.